again, all of you. Really, I'm happy to start with you in the first lecture for our when we start our planning for the online studies. Now we are going to start about our courses. In this semester, we are going to be with you in the some course named International Health. This course is called course code is FDH 423 semester 8. Welcome for this course and hope all of you get the good information, and also we can share the experience ideas with us and to get the benefit from each other. The course objective, general objective of this course, to understand international health regulation and Sudan quarantine law, a specific objective to prevent the disease spread with the minimal disruption to travel. Also, promote the national epidemiological activities and can improve sanitation at port and airport. Additionally, we can apply how we can apply international health regulation and also how the Sudan quarantine law is working effectively. This is the objective of the course. We will learn history of international health regulation, and also we can see the role of the World Health Organization and DCD. Additionally, we can see the disease surveillance and response in Sudan. Moreover, we can go through strategy for improving sanitation and, and, and infrastructure. Uh, Before to go deeply, let me to make a cross check with you. How about my audio? Is it audible or not? My speak is it good? Okay, nice. Yeah. Before to go more, also let us to if ask someone from you what is know about the international health. I'm posing the question for you. What does you understand for the meaning of this word? When someone told you what does mean the international health as a public health specialist, and now you are semi-graduate, welcome Abu Dhar. You can unmute yourself.
Awuzer who? Me or Awuzer Bumi?
Yeah, I saw someone, he raised his hand. There is someone raised his hand.
No, I didn't raise my hand, but okay. In my opinion,
Yes,
international health, it means,
yes.
sorry, it means the way that all countries try to keep the environment healthy and keep our health, improve it, and maintain the health in all around the world.
Okay, okay, good, good. Is there any idea? Another idea? If no another idea, let me to go also. As Wizard he mentioned, how you can keep the health of the nation, of the countries here. Here we are going to go to history of the international health. In the history of the international health, it started in 1969. This is the first regulation there by World Health Organization or to make the control of the infectious disease around the world. When they are see there is the many infectious disease, they are moving from country to country. At that time, the WHO is starting with the regulation for the infectious disease. If there someone are being affected by infectious disease, they are going to restriction for the movement for those people that can reduce transmission rate or transmission of the disease. Yeah. At that time, they are focusing just for the infectious disease in 1969. Additionally, there is another updating in 2005. Also, the WHO is make another updating infectious disease and also added the chemical weapons and also added another environmental hazardous that included in 2005. Yeah. This legislation until now they are working and acting as they regulate the movement of the nation in around the world. Yeah. The rule of the WHO and also CDC, they are focusing, they are make the update about the regulation and also they are monitoring the regulation has been applied among the countries or not yet. This is the agency they are focusing for the how the countries they can apply for the international regulation. Concern for the point of the disease surveillance and response in Sudan. Disease surveillance, as you know, how we can make the collection or the follow-up the trend of the disease. Their continuous collection of the data of the disease in the different points, especially in the health facilities here. Welcome, Chade. You need to say something. You are welcome.
Can you speak louder, teacher? I can't hear you well.
Okay, you're not hearing me well.
Yeah.
How about now? Now you're hearing me.
Yeah, that's clear.
Now it's good.
Yeah, good.
Okay, there is another. Okay. Concern
Okay.
for the. Okay. Concern for the surveillance of the disease. That means how we can follow up the disease among the country in each in the health facilities or in the entry point or in the hospital. They are make the collection data weekly base or daily base, depending on the type of the disease here. With this surveillance that can let us to be vigilant and to be aware how which disease has been trained or which disease has been is going to increase here. And after that, when we realize the type of the disease, just we can make the response, suitable response for that disease here. Also, we will learn also the strategy for improving the sanitation and infrastructure. How we can improve the sanitation? As you know, the sanitation, there is a many disease has been transmitted by the bad sanitation. At the former way, as you mentioned, there is some disease called plague. which you call it the Black Death. Many people have been died with that disease. Yeah. That disease is transfer with the movement of the ship from the country to country. This sanitation, improvement the sanitation that can improve the movement of the people, and also when they are need to transfer some goods or some or movement of the people, they are also can make the check to make sure it is the sanitation. How about the sanitation there? Additionally, there is the many disease transmitted due to the bad sanitation, cholera, and also many type of diarrhea. Now you can see the definition of the international health. It means the health of the population around the nation border, boundaries. That means how you can let the people in the different countries like Sudan, Egypt, and also Chad and Saudi Arabia, how you can make how you can let those people or that population in different countries to be safe, to save their health. This is the international health here. That means it's the health of population across the national boundary. How the people in the different boundaries or in different national to be healthy, to prevent or to protect their health from the movement of the disease. Yeah. The goals of the international health to improve the health outcomes and achieve equity for all. The goal of the international health or of this course, that means that means we are going to improve the health outcomes. Health outcomes like the health of the people to be more healthy. Additionally, to be equity for all. That means there is a developing and developing country. Sometimes you can observe there is a developing country there suffer more for the different kind of the disease here. With this international health, we can make, we can let the health of the developing country also to be good here by put the regulation, and also we can do the cooperation with the different country and work together. The focusing of this course or the focus of the international health, they are focusing in the infectious disease and also focusing in the environmental hazard and health, public health emergency. Infectious disease, as you know, they are diseases that transmit by the microbiology like virus and bacteria and also fungi and also parasites. All of that they call it the infectious disease. And this disease have the power or also have the ability to move from the country to country. Secondly, for the environmental hazards, there's a different kind of the environmental hazards like air pollution or water pollution. All of this, they call it the environmental hazards. These environmental hazards do not have any border, not have any border for the country. It directly can move from the country to country or from the region to region. Additionally, public health emergency. Also, the international health focus the public health emergency. Last 2 years, last two years, as you see how the COVID-19 to do the emergency among the world. That means also the international health also is focusing on the public health emergency. Is there any question for this slide, or there is it clear or need some explanation? Hello?
Yes, teacher, you have a guest is waiting for you to join them.
Okay. Now we can see the key feature of the international health. One of the feature of the international health is the global perspective. The health challenges is the one in one country can affect others. This is the global perspective. And another key feature for the international health is the collaboration. The countries and organization can work together. Yeah, sometimes we you can see the countries they are do the collaboration or cooperation between them to support each other, and even the international organization their work on this year like WHO and CDC agency they also their work on this year. Additionally, the equity that means the reduce the health disparities between the rich and poor country. As you know, there is a big variation between the different country. There is a big variation between the different country, like developed and developing country. Some countries they have ability to support or prevent themselves, and others not have the good ability to do that. Yeah, in this health or in international health, they were doing the equity. Equity we can reduce the variation between them because they are doing the cooperation between each other. Someone is supported each other that can reduce the variation. Thus, the fourth key feature of international health is the prevention and control. The international health mainly is focused on the how we can stop the spread of the disease and how we can manage the emergencies when they are happen or yeah when there is any emergency we can go and also we can control them. As you see the COVID-19, how the agencies and how the countries they are, and let me to say how the international health they are work together and stop that disease. Yeah, this is the key feature of international health. Is there any question on this slide, or we can go up? Hello, do you hear me?
Yes, taught me nothing but can go on.
Okay, good. Why international health is important? This is a question. Let you to also participate. Is ask this question: why this international health is important? One, the disease like COVID-19 and Ebola and influenza spread quickly across borders. This is the one of the important of the international health. As you know, during the COVID-19, within the small days, there is a spree taken place among the different boundaries in the different countries. Second reason, the importance of the international health, the environmental issue. One of the environmental issue is the air pollution and climate change. As you know, right now the top someone else control the presentation. The environmental issue like air pollution and climate change affect the global health. As you know, the air pollution, it is not no the boarding. Definitely can move from the country to country and make the pollution. As you know, or you studied before, acidic raining, how you can cause the problem. Also the climate change. Now you see now around the world is many countries they are suffer from the climate change. This is why the international health is important, because with the international health we can go to control this environmental issue like air pollution and also climate change. You can work together. Different countries and agencies and organizations can work together and control this issue. Third point, the health crisis. As you know, the health crisis also can affect livelihood of the people and also make the disrupt in the economic of the nation. With the international health, they can people or countries, agencies, organizations, they can work together and can control the health issue. All of these points which I mentioned, disease like COVID-19 and influenza spread quickly, and also environmental issue and also health crisis. This is that means it is the importance of the international health. Is there some point need more clarification, or we can go?
Okay, what's the meaning of health crisis? Can you explain?
Health crisis. Right now in Sudan, we have the health crisis. As you see, there is a, let me to say, or let me say, there the cholera, and also there is the many kind of the disease, and also we see the health system is very fragile. People there suffer to get the basic needs, or let me to say, critical drugs at the health facilities. No drugs, even no cardiac. People there suffer more. This is a health crisis because people they not have ability to get the basic needs of the health. If someone is affected by malaria or affected or malnutrition and also can affected by diarrhea, it is difficult to find the service as you see in Sudan. I don't know you are inside or outside here, but really the situation in Sudan is very tough. This is the health crisis here. And also concern for the economic disrupt. If you realize that during the COVID-19, more than 6 months, people they stay inside their house, like lockdown, no work, no move out, no work like that here. Many people they have the stock and also they are chopping this stock and suffer more, not have enough money. Additionally, many factories, many industries has been closed during the COVID-19. All of this is a disrupt economic livelihood worldwide livelihood. People not have the source for or income generation or income source to get the basic need of the life. Yeah, all of this affected international public health or international health can go through this, yeah, or can support this. Now can go for this slide, globalization and health risk. Globalization or health risk also, the international health, they are focusing on this here. As you see, the infectious disease like SARS and Ebola spread rapidly. In 2003, there is some disease or infectious disease called SARS is spread among the nation rapidly. Ebola 2014, COVID-19 2020 or 2019 also is spread rapidly. This is a globalization of the international health. The focusing in the infectious disease. Another point which focus international health focus on it, the environmental hazard like chemical spills. Now there are chemicals compound or chemical materials or air pollution and nuclear accidents. All of this is considered as the chemical hazards. And this can cause or can affect the health of the nation in different countries. Additionally, trade and travel increase the movement of the people and good spirit. All of this also can affect the globalization of the health risk. All of this is the let me to say international health is focusing on this point. Like infectious disease, there is a many type of infectious disease, and this disease is spread rapidly. Environmental hazard. Now, also, if you see the accident taken place in Ukraine during the war between Russia and Ukraine, there is some nuclear accident taken place there, and many people have been affected. Hiroshima, Nagasaki also is considered the environmental health. Their effect not in one country is affect in the different countries. And also right now, if you see in 21st century, the movement of the people is too much. All of this can let the spread of the disease here. Yeah, this is the globalization and health risk. Example of the global crisis like COVID-19 pandemic spread globally and caused a million of the deaths during the COVID-19 pandemic. The millions of the deaths has been died due to the COVID-19, and also many people has been affected, and also people there suffer more. Addition or another example of the global health crisis is the Ebola outbreak. Highlighted as you know, in the West African country like Guinea, Conakry, and also let me to set Senegal, and also many West African country, they are affected with the Ebola. Many people have been dead. The highlighted need international cooperation, and that Ebola crisis 2014 really the people there suffer more. After that, they get the collaboration from the MSF, from the different countries or from different organizations like MSF, WHO, different agencies, DCD, and many agencies there support them, and even the countries there support them. Yeah, Ebola crisis. Additionally, another example of the global crisis, air pollution affect the health across the board. As you see right now, the like USA and China and India, this country is they create let me to say majority of the air pollution come from three countries which I mentioned. But the problem it is not just for those countries. Other countries they suffer. Even here in Sudan and also in the different other countries, also they are affecting from that air pollution. Yeah. Is it clear this is slide or need more explanation or clarification? What is taken? Hello?
Teacher, there are some of us they would like to join.
Okay. Now you can see the international health regulation. What are the international health regulation? Is there someone have the ideas about this, or I need your participation, or let me to say your participation also is important. What does that mean, or is there someone have some idea about the international health regulation? Hello? Hello? Okay, let me to go. The international health regulation, it is a law adopted or put it by 194 countries to prevent the disease. All of these countries around the world, they are sit together and approve it for that law. International health regulation for the 2005, yeah, 2005 there, international health regulation, 194,000 or 194 countries around the world, they are sign it or approve it for that regulation. Ensure the health and limited interference with the travel and trade. Yeah. With the health international health regulation, you can see the law of the movement of the people, or also the traveling between the people. Sometimes they request in the airport to have the card, like yellow fever card, or also some countries they demand you or ask you about the COVID-19 vaccination card. Yes, this is some of the international health regulation. Yeah, yeah. There is a different article and different point there discuss about it. Yeah, how you can control the movement between the nation, and also how you can limit it or restrict the spread of the disease here. Key principles are global health security. Global health security, that means can let the world or the world to be more secure, less health problem like COVID-19, also like Ebola, like this year. With international health regulation, we can save the global, because with this regulation we can restrict the movement of those people who have infectious disease. As you know, the infectious disease can spread rapidly when someone is affected with it. You can spread this from the country to country. This is the global health security. With the international health regulation, we can restrict it or can let the global health security. Additionally, reporting obligation, because it's very important also for the countries to make reporting. Like if there are some outbreak or epidemic taking place in Sudan, the Republic or Federal Ministry of Health should make the report to the WHO or to another agency to inform them in Sudan there is the cholera, or there is the Ebola, and also there is some else disease here. With this, can let them how you can put the plan and how you can control this disease here. This is a obligation for the country to make the notification for the health issue or health problem here. Additionally, to make the capacity building, the international health also you can train the different cadre, or let me to say different health human people, or people those working in the federal ministry of working with the Ministry of Health, how you can make the isolation and how you can do the quarantine and how you can do the investigation for the movement, or for the cars, train, airplane, how you can do all of this here with all of this is the international health regulation. International health regulation is a regulation approved by 1,094 countries and is focusing to organize the movement of the people and restrict those people has affected with the infectious disease. Not just infectious disease, also the chemical hazard, and also weapon, or also let me to say yes, different weapon. With the international health can lead to our countries or the global to be more secure. Additionally, the countries must to make the reporting or make the notification for their cases or for their health situation. If there is some disease, they must share this data with the different organization or also different countries that can let them or can support them to control that kind of the disease. Additionally, can capacity building can train people, teach people how you can in international health, how can control the disease. Now you can see the international health regulation in action. How you can, as I mentioned, there is the international health regulation 2005, see their action. During the COVID-19, the travel restriction, and also quarantine and vaccine and distribution. Yeah. The World Health Organization and also different agency, CDC and also MSF, all of IRC, ICRC, different organization and also different agency and different country, they are put the regulation, especially from the WHO, to restrict the traveling, to not let the people traveling from the country like Sudan, from Sudan to Chad, or from Central Africa to Sudan, they are restricted, or from the Japan to Sudan, they are restricted here. Additionally, make the quarantine. If there are some people there come with the plane, they directly put the in quarantine, like 21 days here in quarantine. After that, you can make sure those people or that traveler they not have COVID-19. Additionally, the request from the passenger to have the vaccination card of the COVID-19. Yeah, all of this is that means the action of the international regulation, because the international regulation they request from the people during the COVID-19 is restricted the traveling and also the quarantine and also do the vaccination and distribution of the vaccination. Also, WHO or World Health Organization coordination provide the medical supply and vaccination globally. It provide the medical supply like nebulizer, medical ICU rooms, medical nebulizer or medical tools, many medical tools. Yeah. Additionally, provide the vaccination globally, like different kind of the vaccine. Even in Sudan, there give them more than 10 million dose of vaccine, like many type of factory like AstraZeneca and also Johnson and Johnson. There's many type of the vaccine during the COVID-19. Those supplies are provided by WHO or international agency. So the role in international health obligation, the Sudan also is a follow on, also he's assigned in the international health regulation 2005 here to do the disease surveillance and reporting. As you know, those people or those team who have worked with the Ministry of Health, especially in the epidemiology department or epidemic department, they are do the surveillance and also do the reporting. And also there's some disease type 1, type 2. Some disease they are reporting daily basis and some of them on weekly basis, some of them they are monthly basis. Yeah. This is the rule of the Sudan with the international health, because in the Ministry of Health there is a reporting for the disease in daily basis and also in weekly basis and monthly basis. Yeah. Legal framework for the health threat. Yeah, also the Minister of Health, Federal Minister of Health, also Federal Minister of Health in Sudan also he have the legal framework for the health threat. Yeah, to know how can control of the different kind of the disease. Yeah. But concern for the international health regulation, there is some challenges facing it. Yeah, like limited of resource. It is need money and also need money resource. Also need the people have good capacity or trained people. Additionally, weak infrastructure. Like one thing which people use in international regulation, like border between the Sudan and Chad and also Sudan and Central Africa, they must have the entry gate. Any person when he's entering in Sudan or go to Chad must be to do with check with them to make sure he not have the infectious disease. Yeah, not have the infectious disease. Yeah, but unfortunately, we do not. Many countries, especially in Africa, not have the good infrastructure to apply the international health regulation. additionally also need more training. Yeah, this is the challenge because some people or many people they don't know how can treat with those people, passenger or people come from the out and have how can treat with them, how can put them in the quarantine, and also how can do the isolation, how can do all of this. Yeah. Additionally, the opportunities for us as a Sudanese or as a Sudan, how you can apply the international health regulation. There is the good opportunities. As you know, there is a many NGO partnership with the Minister of Health, NGOs, and also there is the investment in the technology and training. All of these opportunities can support us Sudanese to to apply the health regulation. Conclusion. In the conclusion, we let us to say the international health is address global health challenges. Yeah, like if, when there is a public health challenges, is addressed by international health. Is the appear some disease like monkeypox disease from different countries. This is addressed by international health because you do the good collaboration between the countries, make the change of expertise and support the many countries. Yeah. Additionally, collaboration is the key to prevent and control the disease. The collaboration between the countries or the nation. Chadia, you need to say something. Hello? Okay. Collaboration is the key to preventing and controlling of the disease. The collaboration between the agency or different countries or organization, this is the way or this is a good step or good way to let us to control the disease. Additionally, by understanding the international health, you can contribute to global health security. When we are applying the health regulation or international health regulation by good way, that means the global health security will be good. We can reduce the different type of the disease among the countries. We can reduce the threat of the health challenges. Yeah. This is the conclusion of our lecture. Yeah. Thank you for your attention. Now I will give you the opportunities if there's someone have question or comment at some point. You are welcome. The mic with you.
Tell us about international travel in international health. How does it play a role?
Could you repeat your question? You said that?
The role of international travel in international health.
Yes.
Did you get
The role of international
travel?
Okay.
The role of international travel in international health.
Okay, or the role of international regulation in traveling. Do you mean that?
Yeah, okay.
Yeah. With the international health regulation, we can control the movement of the people, especially those have infectious disease. Example, if someone from Sudan have affected by by COVID-19, and he directly traveling to Chad. That means definitely can spread the COVID-19 there. And also let me to say, in Sudan, the third case of the COVID-19 in Sudan, which is taken place in 2020, is come from Italy. With the international health regulation, we can make the restriction like the WFP worker which come from the Italy. When we are applying the international health regulation, definitely you can avoid the Sudanese people. First step, we can make the quarantine. All of people who are traveling during the pandemic, firstly, you can put it in the quarantine. You can put it there, like in hotel or in the some place here. After that, when he spent the 21 days of the occupation period of the COVID-19, if he have the some sign or symptom of the COVID-19, directly we can put it in the isolation. If he not have the sign or symptom of the COVID-19, we can release them. That means we can make the cross check. With the international health regulation, we can reduce the spread of the international disease here. This is the role of the international health regulation to passenger or to movement of the people among the countries here. Is there any question? Yeah, you are welcome. Said or who? You are welcome. The floor for you. You can unmute yourself. Hello?
Can you listen to me now?
Now I'm listening you.
Okay, thank you so much, Doctor, for great lecture. My question concerns the goal of international health. So in that point, it has been stated that the goal of international health is to improve health outcomes and achieve equity for all. So in the point of equity, I didn't quite understand it clearly. Could you explain more if it's possible?
Okay. With the international health regulation, this is like a law, or there is a legislation, or the law, there is many article. The sum of the article is like a cooperative between the nation. If the developed country, or there are some countries like Guinea, Bissau, or Conakry have been affected by Ebola. In the international health regulation, is there some point called the collaboration. The all of nation or all of country, they are not sit behind and see the Guinean people their died alone. No, there is an organization that started to support those people by provide them the medical supply, or also train the team there, or also can provide the different health need, and also can even can support by technology how can test it, or let me to say how you can use the good laboratories to make check is it which kind of the type of the disease and how you can control it. Even can support it by the human resource by expertise in epidemiology. This is a collaboration.
Just a point. This means that the helping hand, just in a case if there is a crisis or if there is an emergency somewhere in the world. But in a normal situation, even if you have a small crisis, so on that sense, there will not be an interventions. If I'm correct.
Yeah, they mainly focusing the international health regulation or international health. They are mainly focusing in infectious disease. Mainly focusing in infectious disease, how we can support each other and how we can collaboration between the nation and agency or organization to prevent the infectious disease. Additionally, they also work in the environmental hazard. Sometimes, as you know, the environmental hazard, they not have the border. When some pollution, air pollution taken place in Sudan, definitely this pollution can go to Chad or can go to Central Africa. Also, the international law, international health regulation also focusing on this here. Right now, if you see the developed country, they produce the pollution and developing country affected by this. If you see in climate change conference, their pressure the developed country to pay the money for the developing country to how you can uh, control or how you can face these challenges which come from the pollution or the climate change. Yeah. Yes.
Okay, thank you so much, Doctor. Also, I have another point. Sorry for asking too many questions.
You're welcome.
I can understand that, like some actors, like WHO or CDC, can works in international health. But I have a question: who else can be an institution or an actor that can apply the international health?
Okay. Concern for the international health regulation is this for the whole country. Each country do apply this international or do the another law. Like in Sudan, we have some law called it the quarantine law. Quarantine law is organize the movement of the passenger or movement of the good of movement of the suspected people. In Sudan, we have a federal minister of health. There is the part focusing or responsible for the international health regulation, and they have the team in the all of or in the airplane like Khartoum airplane and also in different areas there. Additionally, in the in the in the interrogate interrogate, but sometimes due to, as I mentioned, some challenges of international health regulation, they will not have the good infrastructure like between Sudan and Chad. People there go and pass without checking, yeah. But in the interway, also they must have the check. And those sometimes they request from the passenger to have the yellow fever card, and also COVID-19 card like that. Yeah, yeah. In Ministry of Health, there is a big department called it International Health Regulation. Yeah, they are follow all of this to apply among the country in different places. Yeah. Is
Okay,
there
doctor, thank you so much.
there is another question or
Again, I have another point.
okay?
I don't know.
Go ahead.
If I am not wrong, um, This is what I have understood.
What?
International health, we applied at national level, like the one that you have said. We have a department in MOH,
Yes.
and then at the regulations concerning quarantine and several other things.
Yes.
So I was thinking about like the people who are working in that department. Do they have some activities uh, led them to move like to other countries for doing some activities related to international health, or it's just in case of emergencies we collaborate with other countries, but otherwise we just keep doing it in our country?
Okay, they are they are working in the different country. They have, as I mentioned, in Federal Minister of Health and also in the different gate in Sudan. Some of them in airplane and also main gate between the countries. Yeah. This team they are taken good training from the WHO and different agencies. Know how you can make the investigation for the different disease, infectious disease, even for the chemicals or weapon and also ionic weapon, have good skills to know treat it. Yeah. The international health regulation, not just for infectious, even for the like let me to set from the ionic weapon also you can focusing or you can responsible on it, and also movement of the goods, like sometimes some goods which come from the some country perhaps they include they have even rodent have rodent. Yeah. Those teams there make the investigation to see this food or this good is this suitable for the country or not suitable. Yeah, because they are need to make sure he's to save the Sudan or to save the country. Yeah, yeah, and also they get the very high level of training in DCD, in Tanta, in USA, and also in Japan or in different countries. For this side, there is a very nice cooperation between the country, because sometimes Japan or DCD provides them the training for all of workers work in the international regulation. Sometimes the WHO, who is leading for this international health, also provides a very high technical training in Geneva and also in Mediterranean region, in different places here and different lab here. They give them very high and very technical training on that. Yeah. Is there any question?
Thank you so much, Doctor.
Yeah, thank you. You are welcome. If no question, now we can let me to set you can close our session. If no question, now we can close our session and we can discuss in next session for the another session, another lecture. Yeah, really, I'm very happy for your good attendance. Yeah, yeah. I know some people they are suffering for the internet or struggling to join. Yeah, I saw many people they're struggling to join, but unfortunately they not. I don't know there some problem, especially Abdul Basit. I saw is try many times, or even Manasik. Many people there try, but I don't know problem where. But doesn't matter. I will take this record and will share with you as soon as possible. Concern for the material also, I will put it in our platform in Classera. I will put there. You all of you have the access to find that material. Yeah. Thank you again, and I hope you all the best. Now let me to say Ramadan Kareem.
Thank you so much, Doctor.
Thank you.
Of
Thank
course, we really enjoyed having a lecture with you. Have a good time.
Yeah, thank you. Thank you a lot. Say hi for your team.
I can say it's a good start.
Yes, thank you. Yeah,
Even me myself, I struggled too much to join the class today because I was on way coming.
yeah.
But at last, I'm really happy to be among of you and being a part of this class.
Yes.
Hope that in the coming days we will improve much more than this.
Yes. By little bit, we can step by step we can improve our skill. All of us here.
Exactly,
And we hope
exactly.
go forward. Yeah.
Thank you
a lot,
so
and
much.
have a good moment. Say hi
Okay,
for.
okay, thank you.
Stop.